All right, welcome again and good afternoon. We'll start today's meeting with presentations from Dr. Clara Pelfrey, Associate Professor and Evaluation Director of the Clinical and Translational Science Collaborative of Cleveland at Case Western Reserve University, followed by ChiChi Nkemere, co-founder of Enlightened Solutions. And let's give a round of applause for everyone who has shown up for all of the weeks. Week 6, very excited, very exciting. So let's learn a little bit about Dr. Clara Pelfrey. Dr. Pelfrey is an associate professor in the Department of Medicine at Case Western Reserve University and evaluation director at the Clinical and Translational Science Collaborative. She has over 19 years of experience in translational science and is most passionate about mentoring women in STEM. Recently, Dr. Pelfrey and the CTSA evaluation researchers petitioned the Journal of Clinical and Translational Science to include retrospective case studies as a manuscript category. The objective of these studies is to deepen knowledge of the transitional process and identify contributors to successful translation. Dr. Pelfrey prepared a presentation that she recorded. She's at a conference right now, but I will start that.
About how I'm the evaluation director for the Clinical and Translational Science Collaborative. And I'm here to talk to you today about how research leads from discoveries to improved health. So in my agenda today, I'm going to talk about 3 things. The evaluation research that we've done to discover these stories that I'm going to show you today. I'm going to talk about how research can go all the way to clinical practice, and I'm going to talk about research to policy. So in evaluation research, we gather evidence of how the research leads to various different outcomes, and those outcomes can include improved health or improved health care, and also how they inform public health policy or new clinical guidelines. So I'm head of a group that is studying translational science case studies. And these are a rigorous way to gather and present evidence to tell the story that led to the improved health outcomes for people. So tell the story of the research from beginning to end. And a method for conducting these kind of case studies didn't exist, so our group developed one. And we published it in the Journal of Clinical and Translational Science in 2020. And we're calling it a retrospective translational science case study of health intervention. And the retrospective part means we go back to the beginning of the discoveries and then bring them all the way through to how they've helped health. So, and this is an example. Just last week, our paper was turned into an audio pod or a podcast by someone called SciPod, and their mission is basically to connect science and society, to help get the science to the average person who may not be involved in research. There also was no mechanism for publishing the translational science case studies. They aren't medical case studies like you find in medical journals. They're case studies of research. So we contacted the Journal of Clinical and Translational Science and explained why we would like this. And sure enough, they were very much open to having a new category of manuscript called the Translational Science Case Study. And it can be published now in the journal, free gold open access. We also developed a classification system for our case study by the type of intervention. You know, was it a diagnostic device? Is it a drug, etc.? And the part that we've highlighted in yellow, the facilitators and the barriers, we're looking specifically at things that helped facilitate the research and keep it going or get it to the next phase. and things that were barriers that they had to overcome in order to get it to have a successful outcome. And then we're comparing those same facilitators and barriers between different cases to learn more about the translational science process. So the first example of a case study starts the next part of my talk, the research to practice talk. And we're talking about Dr. Uma Kirkin, and we wrote a case study, and you'll see the title at the bottom there, a retrospective case study of successful translational research, the Gazelle hemoglobin variant point-of-care diagnostic device for sickle cell disease. And this one was particularly interesting because we took it historically and on this timeline all the way from the inception and development of a prototype in 2014 through the initial clinical studies in Africa and Thailand, and it was licensed by a company, and eventually it was manufactured in India. The devices were manufactured in India. And this is the cover image that you saw is the cover of Analyst Journal. And they did real world testing in sites, including Ghana, Africa. And in 2021, the newborn screening test received regulatory approval. So it took 7 years, but investing in this kind of innovation for underserved populations is now saving lives in the form of identifying babies that have sickle cell. And many, many children are not identified early enough to save their lives. So the second part, I'm going to talk about research to policy. So how has the clinical and translational science collaborative supported research informed policy? And one way is to evaluate how published research findings are used to advance translation. And you can do that with academic citations, news media references, patent references, policy document references, and we particularly are going to focus on policy and guidelines. So the first example of this is where the CTSE supported the SPRINT trial. The SPRINT trial is a very famous trial that compared systolic blood pressure at 140, which is sort of was considered the norm, and they lowered it to 120 systolic blood pressure and monitored for several years, and then they had some very, very interesting results. And two of the main authors on the New England Journal paper were Jackson Wright and Mahbub Rahman. And here's sort of a timeline of the SPRINT trial. And it shows you, it started with the journal article in New England Journal of Medicine in 2015. The clinical research units at the CTSE helped support this research. Over 60 policy documents have cited this particular research. And more importantly, one of those policy documents is the American Heart Association new guidelines in 2019 for keeping people's blood pressure at that 120 level. And it is affecting human health in the sense that they found that this lower target at 120 systolic pressure, it lowered the rate of cardiovascular events by 25%. And even more importantly, it lowered the risk of death by 27%. But another important part of this trial was racial ethnic disparities in Blacks and Hispanics, that they often have higher rates of uncontrolled blood pressure, and Blacks are at greater risk of hypertension-related cardiovascular disease, both morbidity and mortality. And importantly, the SPRINT trial had 30% Black participants and 11% Hispanic participants. So they had sufficient numbers in this trial to prove statistically that these new lower guidelines were true for Blacks and Hispanics also. Another paper was the mild gestational diabetes trial. Again, New England paper in 2008. It was supported by the clinical research units at Metro Health. It's been cited in over 33 policy documents. And one of those documents was the World Health Organization in 2013 that changed their diagnostic criteria for classification of hypoglycemia in pregnancy. And also 24 other clinical guidelines documents also have published these new guidelines. And they recommend the glucose cutoff values that are lower than those that have been recommended previously. And so that's the important part of affecting human health. And the final one I'll talk about is a paper published in 2007 in Child Abuse and Neglect. called How Neighborhoods Influence Child Maltreatment, and it was a review the literature pathway type of paper. And it talked about, this was done by one of our KL2 scholars, and it's cited in 17 policy documents. And the guidelines that came from that were the economic determinants and consequences of child maltreatment by the OECD in 2011. And they argued that a strong link between low economic resources and higher risk of child abuse and neglect. They also say the document concludes that the evidence base for effective prevention programs is very weak and that more research is needed. So in summary, the CTSA goal really is to accelerate the translation of research findings into improved public health. This includes informing new policy briefs and clinical guidelines, as well as publications. Oh, and the publications that we used to discover this policy information, we used in Overton. This is a policy database. The link is there if you're interested. Thank you very much for your attention.
All right. If you have any questions for Dr. Pelfrey, please type it in the chat or you can email me after the session and we'll make sure that those questions are addressed. Now we have our second presenter and I'll share a little bit about her. ChiChi is a strategic thinker. She has over 10 years of experience in community engagement, asset building, and advocacy. She holds a BA in political science and African studies from The Ohio State University with a focus on race and electoral politics. ChiChi is an accomplished curriculum specialist, honing skills as a Teach for America educator in Houston, and is active in various civic projects across the city. She is dedicated to progressive and radically inclusive equity in all spaces and for all people. ChiChi, we look forward to hearing about Project Noir and what's next for Enlightened Solutions.
Awesome. Well, thank you all, first and foremost, so much for being here on your afternoon and welcoming me into this space. Just like she said, I'm ChiChi Nkemere. I am pronouns she, her, and I am the co-founder and director of strategy of Enlightened Solutions, which is a think tank here in Northeast Ohio. So on our next slide, just a little bit about Enlightened Solutions. We implement, publish, and create research-based solutions that center the lived experiences of diverse people. So we use a methodology called phenomenological research, which I'll explain a little bit more about in our actual research project. You all have already seen my credentials, so we can just jump to our focus areas on the next slide. So our three focus areas as an organization are individuals, organizations, and research. First and foremost, we support individuals that are navigating through exclusionary workplace systems specifically, but we've now broadened into healthcare and education as well. We work with organizations that are really interested in investing in equitable solutions within their workforce. And lastly, we publish research, which is what brought us here today. So first, I want to center us around the idea of targeted universalism, specifically around our research project, Project Noir. So what is targeted universalism? On the next slide, we talk about when Black women are safer at work, when Black women are safer in the doctor's offices, when Black women are safer in their classrooms, all women in general are going to be safer. So targeted universalism is the idea that if we set universal goals for the general population that are accomplished through these really hyper-focused, very targeted approaches, we can be able to fix and help ameliorate a lot of the issues that we're seeing in specific subsets and specific populations. And as you can tell, we focus here at Enlightened Solutions on Black women, specifically here in Northeast Ohio. So the script of harassment, discrimination, and alienation of Black women that they receive here in Northeast Ohio is really often very predictable. It's something that we see a lot, and more than that, even down to the words that are utilized, the processes that are used against Black women, it's a really predictable process. Our second quote here on the next slide is that Cleveland has an inclusion problem. We do not have a diversity problem. We do not have a pipeline problem. I'm frequently told by organizations like, how are we going to get individuals coming through our hospital systems? Or how are we going to get individuals coming through our classrooms? How are we going to get these individuals to come through our workplace? And the thing is, if we actually look outside, our city is exceptionally diverse. I think within the city limits of Cleveland, we are about 40% Black population, and within our county, we're in a plurality. We have a lot of individuals that are of diverse backgrounds, even within Blackness, Africans, individuals from South America, from the Caribbean, and we don't necessarily have that focus on what is making certain tensions within the city arise, specifically around healthcare. So that brings us to our project, Project Noir. So Project Noir was a research project about the lived experiences of Black women in Northeast Ohio. And on our next slide, I'm going to sit here for a little bit. Cleveland was ranked the worst city in America for Black women and the poorest big city in America by a study by Dr. Junia Howell. She was working out of the University of Pittsburgh at the time. And she looked at open source data to look at what are the metropolitan areas that are the best places in America for Black women, and what are the metropolitan areas that have been seen as the worst. And specifically, she studied only cities that had populations of over 100,000 Black women living within their greater metropolitan area. So it was a very comprehensive survey. And what Dr. Howell researched and published was that Cleveland ranked steadily at the bottom with regards to three metrics: workplaces, education, and where we are focusing today on healthcare. And after reading that study, after reading the article that was published in City Lab Bloomberg around the study, literally ranking the top cities, the first thing that I noticed was that nobody actually interviewed any Black women in any of the greatest metropolitan areas for Black women, or the worst metropolitan areas for Black women. And that struck me, that struck my partner, Bethany, who's the co-founder also of Enlightened Solutions. And the first thing that we decided to do was to actually just start asking folks, have you ever had these kinds of experiences? What exactly can we do to kind of lessen these disparities? And we ended up accidentally backing ourselves into a research project. So on the next slide, our methodology. We put out a pilot survey. It was very little. I think it was just under 100 respondents. And that pilot survey allowed us to surface some really large scale data, some large scale themes that we were able to test out what our format was going to be like for our actual survey. When we decided to embark on creating the survey, we connected with a lot of local anchor institutions, think tanks in the area to really help us fine tune our research project. So many thanks to the LGBT Center of Greater Cleveland, Community Solutions, Third Space Action Lab, and they really helped us to fine tune our prompts to be able to collect the memories and collect the stories of these Black women in Northeast Ohio. And lastly, we sat down and we interviewed Black women for just about 1 hour to 1.5 hours about their experiences in those three areas. And when we were all said and done, after 6 weeks, we had interviewed just about 450 Black women here in Northeast Ohio, which was a feat in and of itself. Specifically because this was done during the height of COVID. We put out this survey in August 2020 and shut down our operations for a year to really dig deeply into that research. So in about 6 weeks, we collected 450 accounts, 450 survey respondents, and just over 1,000 different vignettes of discrimination and marginalization here And like I referenced at the beginning, we used phenomenological research. So we used qualitative and quantitative data to really pull down into the texture of what marginalization looks like. And what we learned is because of their inherent value, coupled with like widely available existing bodies of research, we were able to really surface what systemic racism looks like here in Cleveland, compounding with misogyny, compounding into what Black women specifically experience in the city, which is misogynoir. So why do we actually research our experiences? There is a complete and total lack of representation in this field. There are a lot of folks that are talking about Black people. There are a lot of people that are talking about Black women, but they're not actually talking to them and elevating and amplifying their stories. So when we talk about actually researching here in Northeast Ohio, we believe Black women first and center that experience. And then we allow them to become experts in their own experience and illustrate to us, demonstrate, show us exactly what it looks like when they are navigating through those systems. And this is a really key point for us. On our next slide, by centering Black women, by centering the lived experiences of Black women, we are focusing specifically on the most marginalized individuals in our region. By centering both race and gender, you are able to solve for things like gender expression, sexuality, ability, both neurological ability, mental ability, physical ability. You're solving for age, you're solving for poverty. All of those different intersections are compounded on race and gender. And by looking at them at the same exact time, you're not peeling away individuals like slices of pie. You're looking at the whole individual as a whole human. Moving on, Project Noir was not designed to prove or disprove this disparate treatment of Black women. And I will drop inside the chat, and again, I will make myself available if you all have questions about deeper into our methodology, but we did not create this survey to be able to say, oh, Black women, it is true or false that your marginalization is happening. I will drop in the chat. You'll be able to hear from the experiences of these women in a short clip of podcast form. But I want to go into some of the healthcare concerns in our last 5 minutes and some of the detailed statistics that we pulled out from our research. So, healthcare, there's some important context around this, why we really want to censor this in our health equity series, is that in Ohio, Black infant mortality in 2015 was about 2.6 times the rate for white babies. Black women have the most hysterectomies, even when adjusted for other things like age, BMI, polycystic ovarian syndrome, all of that, tubal ligation. Black women are having more drastic and more invasive procedures. And lastly, this little graphic, this little screenshot that I have to the right, there was a survey in 2016 of medical students that found that about 40% of first and second year medical students believe that Black people's skin was thicker than white folks. These are individuals that are traversing through your halls of education. These are individuals that may be your colleagues. These are people that are working with Black and underserved populations. And if they're starting out with that, that's going to lead to specifically the research experiences that we've seen from Black women here in Project Noir. So on our next 2 slides, we have about 4 statistics going through. So 60% of Project Noir participants, our participants in our research, were spoken down to or felt that they were spoken down to about their own symptoms, about their healthcare systems, symptoms that they were experiencing when they went to their clinics or their local doctor's offices. 41% of our participants had been told that their health issues were completely and totally made up. Word for word, we had various women talk about how their doctors had told them that they were lying, essentially. Our next statistic, 26% were subjected to unwelcome comments about their sexual life. 34% had been refused medication for pain or pain management. breezing through this last part. Black mothers on the next slide, 2/3 of them are equal or primary sole earners in their household. So it's not an issue about Black women not being gainfully employed or Black women not necessarily having access to high quality healthcare. We live within the nexus of 3 world-class healthcare institutions, and yet and still Black mothers are not necessarily receiving the kind of healthcare services that they really need to lead healthy and happy lives. On our next slide, we can bump through this, but our next slide just really talks about how, from the perspective of one of our participants, a woman was an asthmatic. She was having experiencing severe bronchitis, and her doctor actually told her to go home. This is, again, during the height of COVID. This was during the height of a lot of the panic pre-vaccine. Her doctor had told her to go home and to lay down. And instead, she decided to go to a completely other clinic on the opposite side of town when a doctor that she had walked into the emergency room saw that she was, turning colors and that she was not able to get air through her lungs. And that doctor ended up treating her. Again, you can see that there is a complete and total disparate care level that a lot of medical professionals are giving Black women within Northeast Ohio, and could lead to a lot of, and have led to a lot of really dangerous and grave situations for Black women and their families. Now, lastly, just wrapping up, how does this marginalization of Black women affect our economic standing? I always love to talk about tying our healthcare outcomes to our economic standing to retain and attract talent. 48% of Gen Z, those are those individuals that are about 26 to 12 years of age, identify already as racially and ethnically diverse. 1/3 of Gen Z are members of the LGBTQ community. By 2025, 75% of our workforce will be millennials. That's your 42 to 27-year-olds. 44% of millennials currently belong to groups that are marginalized or minorities. We have to look at this as a protective factor for ourselves as not only practitioners, not only as researchers, but individuals that are actually dedicated to health equity within our region. And that's it. I know that was very, very quick, but if you have any questions, please find us on social media, or feel free to, drop a question in the chat, and I'd be happy, if we have time, to answer any of your questions or listen to any comments that you have. But thank you very much.
Thank you very much, ChiChi. Let's check the chat. Actually, I might have the first question. I remember reading about the City of Cleveland's Commission for Black Women and Girls, and how Enlightened Solutions was integral in really moving that forward. Could you tell the group a little bit about that, please?
Sure. Well, you're gonna make me blush. So how I got involved, how we got involved as an organization on that is, first and foremost, when we published Project Noir, we sat down with local leaders and essentially had coffee tours. So anybody that was running for office and anybody that was seen as a thought leader within the region, we presented Project Noir a lot more in depth, obviously, with them. And when we sat down with the BIB administration, or with the BIB campaign at that point in time, they were very, very interested in this research, and because of it, asked us to create a white paper for them around Black women and girls, specifically for Northeast Ohio. Once we were able to give them that white paper, they decided to place that within their platform. And I was picked to serve on Mayor Bibb's transition team, specifically around equity and inclusion, where I was able to draw down a little bit more into our research for Black women and girls. So our submission for the Bibb administration was twofold. We rounded out our research around Black women and girls commissions. And I always like to say this, kudos to our intern, Kylia Mayer. She is was at that time a junior at Baldwin-Wallace. She's now a senior. And she really rounded out our research around it, searching all across our country around Black women and girls commissions and their successes and a lot of their missteps. And we created a comprehensive document that the Bibb administration, again, wanted to really center. So once he was inaugurated as mayor, he made that a part of his first year plan. So with some pushing and some community support, City Council unanimously passed a Black Women and Girls Commission, which will be moving forward hopefully in the new year with some staffing, with a fully empaneled commission, and hopefully centered on some of the research that we're doing, because the big goal for Enlightened Solutions as researchers is to be able to see, are we actually moving the needle or are we spinning our wheels? So making a Project Noir every single year, literally testing and retesting and iterating to make sure that we are lessening those really horrible conditions, and that we're able to retain Black talent, Black families here within our region. I felt like that was a lot. Anyone else?
Oh, I'm sorry. I was on mute. I was saying that was excellent. And then I had a follow-up question. I apologize.
No problem.
The question was, during your interviews, did any of the participants share that they had been approached to participate in clinical trials or asked if they were curious about clinical research from any of our local institutions?
They were not. It's not reflected in our data. In fact, the majority of our healthcare interviews, I would describe the tone and tenor of the experiences of Black women speaking with healthcare providers as curt. Actually, the word that is used the most in our healthcare interviews was that anything that dealt with sexual health, so anything with sexual health all the way up to birthing in all three of the institutions, the word that was pulled out the most was traumatic. My experience at X institution was traumatic. My experience with these doctors was traumatic. So no, they were not approached with any kind of additional support or additional research or additional even consideration around their healthcare concerns.
Okay, thank you. And Hattie, I saw that your hand was up.
Oh yes, it's just that I heard that you said there was a third year at Baldwin-Wallace who internship for Project Noir, and I was just wondering how many opportunities were available to undergraduates regarding the lab.
Oh, how many were they, if I'm hearing your question correctly, was there an opportunity for undergraduate individuals to participate as interns?
Yes, well, not only as interns, also as possible undergraduate research assistants, like here on Case Western's campus, when students email professors and they're able to begin research in the lab as a lab assistant.
Yeah, funny story about how Kylia ended up becoming our intern. She found us. We never put anything out. We thought, Bethany and I thought we were just going to do this together. We have always been a dynamic duo, and also we are a startup think tank. So we were like, we don't have a lot of money. But Kylia, I guess, saw an interview that we had done, I think around just workplaces, and emailed us and positioned herself. She said, I would like to work with you all. Her areas of focus are Black psychology, specifically around anti-fat discrimination. And she's now about to pursue, she has a couple of different avenues, a degree in, an advanced degree in social work. So she pitched us and she said, I would be a phenomenal research assistant. She became our research assistant and really drilled down into that work. And now after 2 years, we're like, we're never letting her go. Like, she's just brilliant. But to your point, we're always open. But we don't necessarily always put a call out. People tend to approach us and we kind of work that way. But for larger projects, stay tuned in 2023.
Okay, thank you.
Hi, ChiChi, I have a question.
Mhm.
Oh, I'm sorry. Arlette, did you want to go first?
No, go ahead. Go ahead.
Okay. So what was interesting, I know you didn't really touch too much on this, but was the, I guess, the disparity or the mistreatment or I don't know, lack thereof education when it comes to sexual health. You were saying that Black women were experiencing that. That was one of the things that was brought up. Can you elaborate on that, on what that meant and what that is?
Yeah, so it was less education necessarily from the perspective. So a little background on me, I was a middle school teacher before moving into policy and politics and all that stuff. And one of the things that I had a joy of teaching was sex ed in 6th and 7th grade for my students. And what we've noticed isn't that necessarily they're not getting a full-throated understanding of sex ed education at that age and that coming to, you know, when they're adults. It's the lack of education of their options when they're within a doctor's office. So doctors will typically, at least from our participants, will prescribe or will forcefully suggest more invasive methods. So hysterectomies, partial hysterectomies. For Black women, one key pullout from our research was that doctors were a lot more firm about more invasive methods of birth control for Black women. So not birth control pill, not birth control even all the way down to low, like rhythm method, things of that nature for individuals that were ready and willing to get pregnant if they felt. The overwhelming amount of birth control, sexual education that was prescribed within the doctor's office were copper IUDs in general, and more permanent versions of birth control. So it wasn't even that they weren't aware or the education basis wasn't there. It's the fact that their options are so much more narrowed and their options were so much more invasive. And that's just around sexual health. There were other things around just cancer, you know, treating cancer, right? Far more invasive ways of treating cancer and not necessarily high-tech ways of treating diseases. Not allowing individuals, just like the gentleman had said before, clinical trials, you know, things that may be a little bit more experimental. Those options were not necessarily, those pathways were not necessarily given to Black women nor their family members in our research.
Thank you.
I was just going to comment. No, it's not a comment. What am I saying? So some of the stuff that you were talking about, it triggered me because
Yep.
I was also one of those women, and education doesn't make any difference. And I had to shop around. And if I didn't know what I knew, I would have found myself in different situations that would have been traumatizing to me. So as I was listening to you and I was thinking, how do we break the stereotype? Like, how do we get past that? And how do the information that you just shared with us get into the undergrad for those who want to pursue the medical field? How do we get it into the medical schools? But how do we stretch this out? Because usually the people who show up usually either have they know that something is not right. And they want to be a part of the solution. It's the ones who don't show up who still walk around with these biases. So how do we get them into the discussion and educate them?
So I'm so glad you said that. As I stated at the beginning of our presentation, or of my presentation, is that Enlightened Solutions is a full-throated think tank, and we work in 3 different buckets. We do work with organizations. We provide trainings, we provide one-on-one consulting. But again, to your point, Systemic change is not going to come in a 1 or 2 hour training session. You cannot professionally develop yourself out of systemic racism or systemic oppression. Let me just lay that out there very plainly and very flatly. What we do need is a culture shift and a culture change. That is why Enlightened Solutions pushes on all fronts. That's why you'll see us working with government. You'll see us working with city council and helping to pass things that are not just in name only legislation or in name only resolutions. It's to be able to get that verbiage out and utilized a lot more in the public. You'll also see us working with philanthropists, right? Allowing the foundations to understand that, again, charity is not just in name only. You have to be centering and pushing organizations and corporations to really live up to their DEI statements. And I'm certain every single one of you all are looking at your individual organizations and you've seen their DEI statement and you're like, what does that actually mean, right? Enlightened Solutions really stresses the importance that DEI, equity, systems change has to be foundational in every single department. And it absolutely has to be tied to the budget of an organization. Dr. Martin Luther King Jr. states that budgets are moral documents. I want to sit there for a second. Budgets are moral documents. Wherever an organization is putting the most amount of their money, that's where their morals are. If we can actually sit down and say, if you actually believe in equity and inclusion, you need to financially invest in this, you'll see it trickle down into each portion, every portion of your organization, every portion of your department. But until then, it's only going to be in name only. Until then, it's only going to be the individuals that are interested in equity and inclusion that are going to be talking about it. But we have to keep pushing on all fronts and make sure that things like our finances, our budgets are actually tied to equity measures. Because again, as you can see, our region is losing population. We are only browning and getting more gay within our population. Equity and inclusion are not topics that are going to go away in the next 5 years. They're only going to become more prevalent. So getting ahead and being proactive and prepared has to be key.
Can I follow up with another question?
Yeah.
Okay. The other part of it is also the community. So you talked about the women that you interviewed. How do we educate them that if you see one doctor, go to another doctor? How do we get them on board?
I love that you said that. So I'm going to pull up a document that Enlightened Solutions created called it's essentially our safety planning resource. And I'll drop it right here in the chat. But this is a first start. Enlightened Solutions would love to be able to actualize on this and make it more systemic. But this is a document literally that talks about how exactly do you fire a doctor? How exactly do you deal with issues around healthcare? And there's a test in there. So it's a very basic psychological safety assessment. But it allows you to kind of look at your experiences within the medical system, kind of from a bird's eye view and a third person view, and ask yourself these questions. So very simple questions like, my health improves when I work with my doctor, or my doctor takes my pain seriously, yes or no. Afterwards, we give you some specific language and ways to be able to kind of push yourself and make yourself an advocate, and allow yourself to surround yourself with trusted individuals. So if you're looking at, I think the healthcare starts on page 7. These are some words. These are some themes that we saw in Project Noir, that Black women were suffering under: poor complaint systems. Doctors were downplaying their pain. That experiences within these medical institutions, medical professionals were really avoidant. If you take this, very quick psychological assessment, and if you need more, again, all of our contact information is there. And we do field a lot of calls from the community about this, but again, it has to be systemic. And we are just a dynamic duo of 2 with 2 interns working with us. We really do need community support, we need the financial investment to be able to get this out there, and to make sure that folks know that they have options and that the system will protect them if there are bad actors within that system.
Thank you.
We do have one question in the chat, and then Tashiana, you may ask yours. The question is, can you share a bit about the reception or feedback from Northeast Ohio healthcare leaders based on your research and findings?
Sure. I would say that the reception was, in the nicest way possible, anemic. One healthcare system, let's just call them healthcare system Apple, was really interested in our research. They wanted to take all of the meetings with us. They wanted us to peel apart our data. They wanted us to give them their data, our data, and wanted to really understand what was going on within their healthcare system. They had a mass exodus of a particular type of medical professional, and they wanted to know why. And they saw a dip in care, right? Individuals wanting to go through their hospital system. So they were very desirous of our work. When it got down to, okay, bring us on, let's actually do a research study and let's work with you, all of a sudden they did not have any money. They did not want to financially invest, and they did not want to actually look at their own statistics. They stated, if we actually run these statistics, then they'll know, the public will know it's bad, and then nobody's going to trust us. So that kind of crumbled. Then looking at hospital system Mango, they refused our calls. They refused every email, every entry email. We pulled in all of our favors and they were just not interested. And they were very, very avoidant. Healthcare system Banana was a little bit more open to hearing about not only our work and research, but they wanted to do their own style of equity and inclusion, which was, let's just house it in human resources. And that's how we are going to be dealing with health equity. So not even interested in the research around Project Noir, more interested in saying, well, diversity and inclusion needs to include all people. We can't just focus on Black women, people will get upset. So all around very anemic to avoidant.
Tashiana?
Yeah. Hi. First of all, thank you for sharing this. Like my mind is just like, so it's really intriguing. And I guess to some of the points made earlier, I wonder if you have any suggestions or techniques on how to get others involved that may not live. I don't know if it's limited to those that live in the city of Cleveland, but like I live in like the inner ring suburbs, and I just think of like, I wish I would have known about, or just known about this sooner, and I'm glad I do now, but how do you suggest, or what techniques do you have in getting others involved in this and really learning about this work that's being done?
Yeah, so to answer your first question, we did not limit it to the city of Cleveland for individuals living within the bounds for two reasons. Number one, it's one of those cultural things. Black folks have ties within the city, whether they live in the city or they don't. So it is either that you are caring for an elderly relative that is living within the city, or you are working within the city, or your, certain tax dollars will go to the city, certain things like that. We like to look at it as Northeast Ohio. So we look at it as a greater metropolitan area. And the research from Dr. Junia Howell also looks at it that way. So we looked at from counties from Elyria to Lorain, because there are folks that live in Elyria but work here in Cleveland, all the way up northern Ohio. So every single county, if you look on Wikipedia that says Northeast Ohio, that's what we consider the greater Cleveland area. And that kisses like Akron and Canton, specifically for two reasons. Number one, just because it's happening in Cleveland doesn't mean it's not happening in Akron. It's just the fact that our population is a little bit larger. Certain textures or tones may be slightly different. Certain healthcare systems might be slightly different, but the experiences end up becoming the same, and the outcomes end up becoming the same. It's not like Akron has that much better birthing outcomes in Cleveland. It wouldn't happen that way. So inner ring suburbs, absolutely. To your second question, how do we get the word out? It's just a slow process is what we are learning here in Cleveland. What a lot of think tanks do, what we do is we don't just necessarily keep or curtail our research to, or the organizations that we work with to just Cleveland. So we take clients from everywhere. We have a client out in LA, we have clients in New York, and we just talk about the things that are happening in Cleveland, because specifically around the research project, if we know that Cleveland is the epicenter of inequality, if we can solve it in Cleveland, you can solve for inequality in New York. You can solve for inequality in Atlanta. You can solve for inequality in Dallas. It truly doesn't matter. This is the epicenter. This is where you can see that those disparities are the most wide. Again, tone and texture and region will look a little bit different there. But again, to your point, it's just the heavy lift of talking about it, contacting the folks that you need to contact to bring us in, sharing the research, getting it out there, because again, systems are really entrenched with not trying to listen to this. Social media will tell you, like, if you talk about the negative things, your business will implode. We think about it differently. If we're starting at zero, there's only one way to go, and it's up. We're not going to necessarily, if we just keep getting worse, we're just going to keep getting worse. But sunlight is the best disinfectant. And as long as we keep talking about this and pushing this out, we firmly believe that these metrics will change.
I'd like to share a slide that's inspired by the chapter that we focused on this week that literally sums up everything you just said and everything that you do. So what must policy makers understand? 1, the conditions that entrench health inequities. 2, actions it would take to upend this entrenchment at local, regional, national, and international levels. And then 3, the level of collaboration that's required across sectors. So this is literally what Enlightened Solutions does. And this was the focus of the chapter for this week. So we thank you so much for sharing, for enlightening us and being very solutions oriented and driven and inspiring despite, the reality. Reality is harsh and, it can be a bitter pill, but if we're willing to all work together, collaborate, and kind of move toward the same goals, we can definitely get there. Were there any other questions, comments for ChiChi?
Can I, so we have a sisterhood of undergrad students, and I would like to pass on your name and the information and the slide, and the link that you gave us. And hopefully I can get the sisterhood of students, undergrads, to bring you back so that you can talk to other women about the things that you just shared with us. So I'm going to talk to them about that.
I would love that. Please, please, please. And
Let's start somewhere.
Thank you. I put my email in there, but if you look up Work Enlightened or Project Noir, I'll be the one I'm the social media one. So I'll be the one to answer your emails and all of that stuff. And again, thank you for allowing me to take extra time. You all had a lot of really brilliant questions that I was just very jazzed to answer because I love talking about this and I'm very passionate about this. So thank you very much all. Thank you.
Thank you, ChiChi. And please join us next week on Thursday, November 17th. We'll hear from Dr. Umit Gherkin and about all of the great things he's doing on an international level to solve for health equity. So everyone enjoy the rest of your afternoon and we'll see you next week. Thank you again, ChiChi.